Hi there, Dr. Arlene Dubier here, naturopathic doctor and birth doula. Today we're going to talk about chronic pain and if it has any relation to food. So the answer might not be what you expect. The answer, in short, is pretty much it depends on the type of chronic pain. So the rule of thumb is that if you have an injury or some sort of chronic pain that goes away and then has a tendency to flare up regardless of what you're doing, then it might be related to food or food sensitivities, which I'll talk about what a food sensitivity is later on. And if it's some chronic pain that is present regardless of what you do, so for example, these are conditions like endometriosis, where you have chronic or cyclical pelvic pain and you know kind of what it's related to, and things like IBS, where you have abdominal pain that can be related to food, but not food sensitivities specifically. So the difference between a food sensitivity versus a food allergy, certain people have food allergies, most commonly to things like eggs, nuts, and those are things if you eat them, it creates this immediate, sometimes life-threatening response. So this could be things like itchy eyes, itchy ears, watery eyes, runny nose, and things as severe as feeling your throat close. So that is a food allergy, something that's more immediate and usually requires epinephrine or a visit to the hospital or emergency. And a food sensitivity is something that's more subtle. So it's not an immediate reaction and can take some time to appear, as early as 24 hours to as late as 48 or 72 hours. So reactions like this could be feeling bloated, feeling fatigued, low energy. It could also present as a flare-up of pain. So a large part of your immune system actually lives in your gut and digestive tract. And this is where a lot of inflammatory markers can be created if you do have food sensitivities and foods that your immune system is responding to. So the best way to figure out if you do have a sensitivity is to do something called an elimination diet. So that's where you remove the most common food triggers for about 3 weeks and slowly reintroduce them and monitor your pain levels, your digestion, your energy levels, etc. Working with a naturopathic doctor or a holistic nutritionist is often a good idea just because they can coach you on which foods are best to reintroduce first, and can also involve a gut healing protocol with supplements and other foods to help heal your gut to make you less responsive to these potential food sensitivities. So as I talked about earlier, it might be slightly different in the case of endometriosis and IBS. For IBS, there's a specific other type of modified elimination diet called the low FODMAP diet, which works similarly to the elimination diet in that you're removing certain foods and then bringing them back in to see how your pain scores and digestion are affected. So if you want to learn more about chronic pain and food, definitely feel free to book a free 15-minute consult with me. And if you have any other questions, leave them down below.